There's a new version of the Omicron strain, also known as BA.2, or the stealth variant.
Some data suggests it could be even more contagious, but there's a lot we don't know.
And the CDC is expecting to submit data as early as today to request vaccine approval for kids under 5. EW Health's Chief Quality Officer, Dr. Pothof, joins us as he usually does on Tuesdays. Welcome back.
Hi, Dr. Pothof.
Hey guys, good to see you.
How concerned are we with this evil twin, this BA.2 Omicron variant?
Yeah, I think evil twin's a good way to put it. So, something to pay attention to, but I think it's important for folks to know that this is not a variant that is like Delta to Omicron. This is like Omicron and then Omicron's little sister. It might be a little bit more contagious than Omicron, but as far as vaccine effectiveness against it, it's the same. Its ability to cause, severe disease, about the same. And with folks, vaccinated recently having Omicron infections, I think, at best, this can maybe slow down our decrease in cases. But I don't think it's going to result in another spike.
The vaccines should work for this, so that's encouraging to hear. But how will that affect the overall peak of the Omicron variant locally?
Yeah, I think, where we are right now is we're clearly off peak. We're coming down on our curve. And if it's like the rest of the world and the rest of the United States, that come down can be fairly quick. If we see more of this BA.2 variant, it may spread that downward curve out a little bit. It might take a little bit longer to get to low case levels, but that would likely be the most likely impact that it would have. I don't think it's going to turn our downward curve into an upward curve.
And this isn't really surprising, because this is how viruses work.
Yeah, absolutely. It's, we haven't talked a lot about subvariants during the course of the pandemic, and most of them are irrelevant. This one, being maybe a little more contagious, gets some attention. But, these viruses, they really don't have proofreading when they replicate. So they make mistakes, and sometimes those mistakes make these subvariants.
Well, just this afternoon, Pfizer announced it submitted for emergency use authorization approval for a 2-dose vaccine for children ages 6 months up to 5 years. That's something a lot of parents have been waiting for. Is that something you expect to see soon?
I do think you'll see this approved relatively quickly. The safety profile on this vaccine is very, very good. There's really not much concern about the safety profile. If you remember, the efficacy of this initial 2-dose Pfizer regimen was called into question. They reduced the dose by 10-fold, and they weren't seeing the robust antibody response that they thought they would see. So what I think you'll see is this 2-dose series approved. It'll be good for kids to get that. They won't have the same protection as if they had been, say, a 15-year-old and gotten that 2-dose series. But then I think a month later or so, you're going to see this turn into a 3-dose series initially for those 6 months to 5-year-old kids. That will give them the same protection as other kids and adults have seen with the Pfizer vaccine.
And there seems to be some hesitancy for the 5 to 12-year-olds. We're only at, like 28%, something like that?
Yeah, the uptake across the state has been a little bit lower. I think there's this misconception amongst parents that, COVID-19 is just not a big deal for their kid. And, back in 2020 with kind of the original COVID-19 virus, maybe an argument for that, although not strong. With Delta and now Omicron, we have seen much more COVID-19 in kids in this age group. And although they don't die at a significant rate, they do still suffer from those complications, long-haul COVID, brain fog, loss of smell, things that are really disruptive to those kids getting back to a normal life. So there is a strong recommendation to get those kids vaccinated at this point if they're eligible.
What is the situation right now at UW Hospital?
So I think we're seeing a bit of a change. Across the state, we've seen lower hospitalizations of COVID patients. That hasn't necessarily been the case here at UW Health. We still have a fairly high number of COVID-19 patients, but we're starting to see a change with a lot of those patients now being admitted with COVID. They have mild symptoms, but they're here in the hospital for a different reason. It's challenging for us because they still need isolation, but we're seeing a less percent of our COVID patients being admitted with, those severe respiratory symptoms that often land them in the hospital for days, if not weeks at a time, that consume a bit more of our resources. So we're not in the clear yet, but we are starting to see that shift.
Yeah, not to be overly optimistic, but things going down just a little bit?
I feel optimistic about the direction that we're heading. I'm really hopeful that we can get to an endemic state where this becomes, more like an annual booster shot, low-level COVID cases. Some people will still get sick, but not so many that we have this rush on the healthcare system, and people, whether they have COVID or not, can't get the healthcare that they need. I'm hopeful that we don't have another variant that surprises us sometime in the near future.
Yes, hope so as well. If you're exposed to someone who tests positive and you quarantine as a precaution for 5 days and you show no symptoms, are you good to go after that to go back out as normal?
Yeah, so the most likely scenario is if you're exposed to someone who has COVID-19, if you're going to get the disease, you're likely to have symptoms anywhere from like that 3 to 5 days, the majority. Now, there's a small group of people, 10 to 20% of those who are going to be positive, that will convert at that later date. So I wouldn't necessarily say at day 5, you can throw caution to the wind. Certainly at day 5, if you start having symptoms at day 6 or 7, it could very well be COVID. But if you're at day 5 and you're feeling pretty good, most of the risk is already behind you.
All right, well, let's hope things continue to improve.
Yes.
We'll see you next Tuesday with some, hopefully, good news.
There you go.
Doctor, thanks for being with us
Thank
today.
you for your time, Dr. Pothof. Great to see you.
Final check your forecast is coming up.